Assalamualaikum and very good morning. My name is Ahmad Zainab Bisharim. We are from group 94. We are choosing topic about COVID-19. Firstly, we should know what is COVID-19. COVID-19 is infectious disease caused by a newly discovered coronavirus. Most people who fall sick with coronavirus will experience mild to moderate symptoms and recover without special treatment. The virus that causes COVID-19 is mainly transmitted through droplet generated when an infected person coughs, sneezes, or exhales. These droplets are too heavy to hang in the air and quickly fall on the floors or surfaces. You can be infected by breathing in the virus if you are within close proximity of someone who has COVID-19 or by touching a contaminated surface and then your eyes, nose, or mouth. Presently, the impact of COVID-19 in daily life are extensive and have far-reaching consequences. This can be divided into various categories, and first we should see that effect on economy. Prime Minister Yassin mentioned that Malaysia's economy is losing an estimated 2.4 billion Malaysian ringgit daily during the MCO, a total of 63 billion Malaysian ringgit, as all the business activities are suspended. The implementation and subsequent extension of the Movement Control Order (MCO) have greatly affected Malaysia's economic performance. The broad-based travel restriction and travel risk aversion have affected all tourism-related sectors. Global supply chain disruption pressured the production and trade activities of the manufacturing sector. The cumulative loss incurred by the electrical and electronic (E&E) sector are estimated at 7.28 billion Malaysian ringgit of GDP, while the impact on export is estimated at 29.12 billion Malaysian ringgit. The decline is private consumption and investment due to reduced household spending, heightened financial market volatility due to ongoing external uncertainties, mainly to tighter domestic financial market conditions. According to the Department of Statistics Malaysia, the USM, as of 1st May 2020, 67.8% of the total 4,094 Malaysian company responds that no sale or revenue during the MCO period. The companies may challenge are the financial source for salary and rental payment and low customer flow. The unemployment rate is expected to rise to 4.2% in 2020 due to closure of business operation during MCO. The Prime Minister have announced some of Malaysian budget to help nation due to COVID-19 disease. This is for three. First is National Economic Recovery Plan, Pelanjana Semula Ekonomi Negara, Kita Prihatin Economic Stimulus Package, and Prihatin Rakyat Economic Stimulus Package. And next, we see what have impacted in another thing.
Hello, today I will talk about the effect of COVID-19 on mental health. Since the World Health Organization declared that COVID-19 is a pandemic, Herbie that countries all over the world has taken the action to preventing the spread of the virus. The COVID-19 pandemic had a major effect in our life. People are facing challenges that can be stressful. Stress can cause changes in appetite, difficult to concentrate, and making a decision. For example, in our country, Malaysia, the Prime Minister announced total lockdown since last year on March 2020 until today. The COVID-19 pandemic have negatively affected economy and the result of the lockdown, people are forced to stay at home. During lockdown, people undergo high levels of emotional distress than normal. Many people losing their job as well as their income. This leads to depression and stress. As we can see, the COVID-19 pandemic teaches us to practice the new norm, such as social distancing, to reduce the spread of COVID-19. This will make us feel isolated and lonely, that can increase anxiety as well as insomnia. People's lives are not same anymore. Their movement are restricted. Faced with new realities of working at home, temporary unemployment, homeschooling for children, and lack of physical contact with other family members, important for our mental health. That's all from me now. I leave it to you, Mr. Fizal, to talk about the effect of COVID-19. Thank you.
The new norm of COVID-19 nowadays have affected the education sector as well. School and university need to close to break the chain of COVID-19. Ministry of Education has ordered that all teaching and learning activities should be carried out online and face-to-face is not allowed. There are few effects that we can see. A major challenge for education and students to attend online class learning. Internet accessibility become one of the important things in conducting online class. However, some students living in rural area may have a less internet coverage. Therefore, these students need to be reaching by connecting them to more suitable platforms such as WhatsApp, Telegram, and Messenger application. This is a very important prevent students from missing out on learning season. The next implication of online learning implementation is emotion management, the extent of movement control, or the MCO period for continue a week made students begin to feel boring at home. Students are unable to meet peer play and chat with close friends at school or undergo co-curricular activity. This causes the student emotion start to experience instability online learning season that have a specific school set by the educator should also take into the consideration of role of student to help parents at home. Therefore, a special counselor platform need to be created by the school or university. Counseling support is essential during this MCO, as well as help students cope with new learning norm. Our education system need to change regarding with this new norm. All patients should play a role to find the creativity action and solution to adapt with COVID-19 pandemic. We all do not know when the COVID-19 will go, but it is the responsibility of all patients to ensure that the virus does not continue spread.
Hi madam, my name is Crystal bin Hakiau and my metric number is JK/13102/19. Okay, today I will explain one of the effect of COVID-19 virus, which is the effect of COVID-19 virus to human health. Okay, as we know, the COVID-19 virus is cause many people to be hospitalized and even worse, cause many deaths around the world. As of 11 February of 2021, more than 207 million cases had been confirmed and more than 2.35 billion deaths caused by COVID-19. As the pandemic unfolds, we are learning that many organs beside the lungs are affected by COVID-19, and there are many ways the infection can affect someone's health. While most persons with COVID-19 recover and return to normal health, some patients can have symptoms that can last for weeks or even months after recovery from acute illness. Even people who are not hospitalized and who have mild illness can be experience persistent or late symptoms. The most commonly reported long-term symptoms such as shortness of breath, joint pain, and chest pain. Other reported long-term symptoms include depression, muscle pain, fast beating heart, and many more. More serious long-term complications appear to be less common but have been reported. These have been noted to affect different organ systems in the body. This is include cardiovascular, inflammation of the heart muscle, respiratory, lung function abnormalities, and renal, acute kidney injury, and the last one is dermatologist rash and hair loss. Also, neurological, smell and taste problem, and psychiatric is cause depression and anxiety. Okay, to prevent this COVID-19 virus from spreading further in the community, action should be taken to prevent it. So the best way to prevent COVID-19 virus from spreading further in the community is wear a mask in public places, and also stay in at least 1 meter away from other people. Frequently wash your hands and avoid crowds and confined space. Besides that, community must always practice new normal in carrying out daily activity. Not because of ego, many will be impressed, especially the community around. Okay, the government also have a very important role to play curbing the spread of COVID-19 virus. As being implemented in Malaysia now, which is the Movement Control Order (MCO). However, this Movement Control Order must be implemented more strictly to control the movement of the local community in an effort to control the infection COVID-19 virus from spreading further. Lastly, as responsible society, let us together prevent this virus from continuing spread. Okay, we from group 94 all to say thank you and stay safe. Please stay at home. Okay, thank you, madam. Bye.